Managed healthcare, the impact on social needs. This video is for SWG 632. I'm going to discuss the background on managed healthcare today in today's society. Additionally, we will identify two different perspectives of managed healthcare, and we will delve further into a few reasons why managed healthcare is beneficial for society. The 1900s, managed healthcare enrollment increased. It has become a standard of insurance rather than an option. One of the many services affected is social services, including the mental health field. This change has affected how healthcare functions on a day-to-day basis. Managed healthcare has altered how social services have been authorized and paid for by insurance companies. It has changed the reimbursement rates for providers. The authorization and denial process can often be problematic to meet medical criteria for social services, including mental health conditions, as opposed to other medical conditions. The process becomes more laborious, and sometimes social services have a harder time getting authorizations compared to, say, a medical provider for asthma or diabetes. Managed care has also changed the view of how quality of care is looked at, which includes requiring certain standards to meet medical necessity, which in turn is their authorization for services. Healthcare debate issues surround managed healthcare since its inception. Complaints are varied. There are three main complaints that the World Health Organization explored. One, does managed care create cost savings for healthcare? Does managed care actually save the money for insurance and healthcare dollars in order to utilize these funds in a more effective and efficient way? Number two, many providers have argued that the provider reimbursement rate is lower since the inception of managed care. Does this lowered reimbursement rate equal less services, less help, and or less care? And then number three, are there lower standards of care due to staff time spent in authorizations, the denials, and the appeals process, which takes quite a bit of time? And due to the restriction of specialty doctors and providers and hospitalization, is there a lower level of quality of care once being given due to less restrictions that used to exist? Currently, with managed care, they restrict more on the specialty doctors and the hospitalizations. And then, is limiting the authorized lengths of stay affecting the quality of care an individual is being given? Some people are being removed from stays that sometimes they would have been staying longer. We've seen that in some of our other classes, in the movies we've seen. Is there a problem? 90% of employees are in managed healthcare. While many people are engaged in these services, it has become a standard of healthcare. The statistical information that exists is mixed on the subject, if it is a problem. For example, 60% of people believe managed care had either not made a difference in healthcare costs containment or had actually been responsible for increasing healthcare costs. Despite this, studies have also found that healthcare premiums are decreasing, in some cases by 13%. Additionally, hospital costs have been reduced in 25% in some cases. However, some of these cost savings would infer less care is occurring, not necessarily more efficient care is occurring. Some studies have found that no difference between managed healthcare and no managed healthcare with the uses of services by people. However, others have found that in the United States invests less in social services than other nations with the inception of managed care. So where are these health savings going, and is it actually working the way that we need it to work to be a more functional healthcare system? There's a lot of unknown questions and answers. So does it work or does it not work? Does managed care work or does it not? Is it helping people with social services, or is it impeding it? briefly discuss two positives for managed healthcare and what they're doing for healthcare in general. There is a case to be made that managed healthcare is positive for social services and healthcare in general. One example is the cost benefits of managed healthcare. And another example that we'll be discussing is improved standards of care throughout healthcare because of the requirements that managed care requires. Managed healthcare saves money. One of the issues at its inception of managed healthcare was the inflation of insurance. The cost of insurance was increasing due to the increased services. In some cases, it was the overuse of services, and this was creating a funding issue to get, the premiums were getting higher and higher, and the costs of paying out to hospital stays and all of that stuff. So one of the advantages of managed care was the change in emphasis in what was once inpatient procedures turning into outpatient procedures, which helps with the bottom line. The expansion of managed healthcare has played a major role in restraining the growth in healthcare spending. In fact, prior to the increase of managed healthcare, there was an average of a 3.3 rise annually in healthcare spending each year. Then after managed healthcare, there was a decrease from 13.7% to 13.5%, which is significant. Additionally, healthcare premiums have been reduced due to managed healthcare's inception. In one study, the decrease in premiums was 13%, and the hospital costs were decreased 25%. The concept behind these savings is that the money that's saved can keep the premiums lower and the patient's costs lower as well, and increase funding into needed services that couldn't be afforded before, as far as out-of-pocket costs go. An additional positive of managed healthcare is improved healthcare standards. It is now standard to complete utilization reviews for several services that are provided, especially in social services. This process brings with it a setup of standards that you're required in order to get a pre-authorization for services, or what managed healthcare would call medical necessity. To put it simply, if the medical necessity is not met, the services will not be authorized, and the insurance won't pay for the service. The duty to get the proper authorization falls on the provider to meet what the managed care company considers is that medical necessity for that service. So there is a set of standards that is required in order to get paid. These standards weren't necessarily enforced previously in order to get a payment. So it's much more regulated with how they do things, and the standards are clearly set and need to be met in order for payment to happen. In one study, 41% of patients that were surveyed with managed healthcare insurance reported that their care they received was excellent. Almost 23% said that it was good or very good, and only 6% rated that the care was fair or poor, which basically in this survey kind of demonstrates that there's very few people in this that actually think that the quality of care is reduced. In conclusion, the topic of managed healthcare is still under heavy debate, and there's lots of policy discussions on it. It reaches both national and international news. There continues to be pros and cons of managed healthcare and the effects on the healthcare system. Many questions are still unanswered and unasked. So there's a lot more to be had on this subject. I hope you enjoyed my presentation, and thank you so much for watching.